Have you ever stood up from a chair and felt that telltale creak in your knees? Or maybe you've noticed you're not quite as tall as you used to be. I remember the day my mother called me, her voice shaking, to tell me she'd fallen in her garden. It was just a little trip, she said, but my wrist just snapped. That's when I realized something many of us don't want to face: our bones age, sometimes faster than we do. And sometimes they age silently, until something breaks. I'm Dr. Sarah Mitchell, and for the past 25 years, I've specialized in helping seniors understand and improve their bone health. Today, I want to talk to you about something that could quite literally save your skeleton: bone density testing. It might not sound exciting, but trust me, what you don't know about your bones could change the course of your golden years. You know, when I was in medical school, one of my professors said something I've never forgotten. He said, "Your bones are alive," and he was right. Our bones aren't just rigid structures holding us up, they're living tissue, constantly breaking down and rebuilding. When we're young, this process works beautifully. Our bodies build more bone than they break down. But around age 30, yes, as early as 30, this balance shifts. We start losing bone faster than we create it. For women, this process accelerates dramatically during menopause when estrogen levels drop. I've had patients come to me shocked when I tell them they've been losing bone for decades without knowing it. One gentleman, a 72-year-old former marathon runner named Robert, couldn't believe it when his test showed significant bone loss. "But I've always been active," he told me. "I thought that protected me. Being active helps, absolutely. But here's the truth: you can't feel bone loss happening. You won't wake up one morning and think, 'My bones feel 10% less dense today.' It's completely silent until suddenly, a minor fall results in a major fracture." So what exactly is this test I keep mentioning? A bone density test, or DEXA scan as we often call it, is essentially an enhanced X-ray that measures how many grams of calcium and other bone minerals are packed into a segment of your bone. The test itself is remarkably simple. You lie on a padded table while a scanner passes over your body. It's painless, non-invasive, and quick, usually taking less than 15 minutes. You don't need to change clothes, as long as they don't have metal buttons or zippers in the areas being scanned. I remember my own first bone density test at age 55. I was nervous, not about the procedure but about the results. As doctors, we sometimes make the worst patients. But the technician was wonderful, explaining every step. "Just breathe normally," she said. "This machine is measuring what took your body decades to build." The test typically focuses on areas most likely to break due to osteoporosis: your hips, spine, and sometimes your forearm. And unlike some medical tests where you wait anxiously for results, many clinics can give you your scores right away. Now, let's talk about what those results actually mean, because this is where many people get confused. Your bone density test results come in two key numbers: your T-score and your Z-score. Your T-score compares your bone density to that of a healthy 30-year-old, essentially bone at its peak. Your Z-score compares you to others your same age and sex. Here's how to understand your T-score. A score of -1 or above is considered normal. Between -1 and -2.5 indicates osteopenia, or lower than normal bone density. Below -2.5 means osteoporosis is present. I had a patient, Elena, who came in clutching her test results like they were a failing grade. "Doctor," she said, "it says I'm at minus 2.1. Is that bad?" I explained that while she didn't have full osteoporosis, her minus 2.1 score meant her bones were significantly weaker than ideal. But, and this is crucial, knowing this gave us the opportunity to act before a fracture occurred. That's the beauty of this test. It's not just a diagnosis, it's a window into your future that allows you to change course if needed. Now you might be wondering, do I need this test? And if so, when? Generally, I recommend bone density testing for women 65 and older, men 70 and older, anyone who's had a fracture after age 50, people with rheumatoid arthritis, anyone with a parent who had a hip fracture, people who have been on certain medications like prednisone, women who experienced early menopause, anyone with significant height loss. I had a 58-year-old patient, Margaret, who didn't think she needed testing yet. "I feel fine," she insisted. But her mother had broken a hip at 70, and Margaret had gone through menopause at 45. When we finally did the test, we found she already had significant bone loss. "If I'd waited until 65, she told me later, I might have already broken something. The timing matters because bone loss is progressive, and the earlier we catch it, the more options we have." Most insurance plans, including Medicare, cover bone density tests for women 65 and older and men 70 and older. But if you have risk factors, many will cover it earlier. You know, when we talk about bone health, we're really talking about quality of life. This isn't just about avoiding fractures. It's about maintaining your independence, your mobility, your ability to do the things you love. I think about my patient Carl, who at 78 was still tending his 2-acre garden and taking his grandkids fishing. When his bone density test showed early signs of osteoporosis, he looked at me and said, "Doc, I can't be fragile. I've got tomatoes to grow and fish to catch." The statistics are sobering. After a hip fracture, only about half of seniors return to their previous level of independence. About 20% require long-term care. And sadly, hip fractures are associated with a significant increase in mortality in the year following the fracture. But here's the hopeful part. This isn't inevitable. Not at all. When we identify bone loss early through testing, we can take steps to strengthen those bones and significantly reduce fracture risk. I've seen patients increase their bone density by 3–5% in just a year with the right approach. That might not sound like much, but it can mean the difference between a bone that breaks and one that bends. A bone density test gives us valuable information, but it's just one piece of the puzzle. Your bone health is influenced by so many factors, some you can control and others you can't. Factors you can't control include your gender. Women have less bone mass than men to begin with. Your age. We all lose bone as we age. Your family history. Bone density is partly genetic. Your frame size. Smaller bone people have less bone to lose, but here's what's empowering. There are many factors you can control. Diet plays a huge role. Calcium and vitamin D are the stars here, but other nutrients matter too. I remember a patient, Doris, who avoided dairy due to lactose intolerance and rarely went outside because of her fear of skin cancer. Her vitamin D levels were among the lowest I'd ever seen, and her bones reflected that. Exercise is absolutely crucial, particularly weight-bearing and resistance exercises. Your bones respond to stress by getting stronger, just like your muscles. Then there are lifestyle factors. Smoking reduces blood flow to bones. Excessive alcohol interferes with bone formation, and being significantly underweight increases fracture risk. medications can have a major impact too. Long-term use of steroids like prednisone can be particularly damaging to bone. I had one patient who'd been on prednisone for her asthma for decades. When we finally did a bone density test, her spine showed severe osteoporosis. "No one ever told me this could happen," she said. "That's why I'm telling you now." So what happens if your bone density test shows you have osteopenia or osteoporosis? First, don't panic. This is information, powerful information that allows you to take action. Treatment approaches generally fall into several categories. First, lifestyle modifications, the foundation of bone health. This means optimizing your calcium and vitamin D intake, incorporating bone-strengthening exercises, quitting smoking if you smoke, limiting alcohol, and reducing fall risks in your home. For some patients, this is enough, especially those with mild bone loss. My patient James increased his bone density by 2% in 1 year, just by adding resistance training 3 times a week and increasing his calcium intake. Then there are medications. We have several classes of drugs that can help. Bisphosphonates like Fosamax and Boniva, which slow bone breakdown, hormone-related therapies that can help replace estrogen's bone-protecting effects, biologics that target specific bone-regulating proteins, newer anabolic agents that actually stimulate new bone formation. I remember explaining these options to Martha, a 72-year-old with severe osteoporosis. She was hesitant about medication. "I don't like taking pills," she told me. I understand that concern, many of us share it. But I also explained that with her fracture risk, medication could reduce her chance of a life-altering break by up to 70%. Sometimes medications aren't just an option, they're a lifeline. The right treatment depends on your specific situation, your bone density results, your age, your overall health, and your personal preferences. This isn't one-size-fits-all medicine. You know, we've talked a lot about the physical aspects of bone health, but there's an emotional component too that doesn't get enough attention. I've seen the fear in patients' eyes when they receive a diagnosis of osteoporosis. For many, especially those who have been active and independent their whole lives, it feels like a betrayal. "My body is letting me down," they say. Ruth, a 68-year-old former dance instructor, broke down in my office when her test showed severe bone loss. "I've always been so strong," she whispered. "Now I feel fragile." That word fragile carries so much weight. None of us wants to feel fragile as we age. But here's what I told Ruth, and what I want to tell you. Knowledge is not a burden, it's power. Knowing the state of your bones doesn't make you more fragile. It gives you the opportunity to become stronger. I've seen the relief wash over patients' faces when they realize that this diagnosis isn't a sentence to a life of limitation. It's an invitation to take control. And that control often leads to confidence. When Ruth came back 6 months later, after following her treatment plan diligently, she stood taller, not just physically, but emotionally too. "I'm not afraid anymore," she told me. "I know what I'm dealing with, and I know what I'm doing about it." That transformation from fear to empowerment is perhaps the most rewarding part of my work. When we talk about bone health and preventing fractures, we're actually addressing 2 sides of an equation: bone strength and fall prevention. Even the strongest bones can break if a fall is bad enough. This is something my patient George taught me in a powerful way. George had good bone density for his age of 82, but he lived alone in a 2-story home with area rugs on hardwood floors, poor lighting on the stairs, and a bathroom without grab bars. One night he got up to use the bathroom, tripped on a rug in the dark, and fractured his hip. During his recovery, he said something I'll never forget. "Doc, I was so careful about taking my calcium. I should have been just as careful about those darn rugs." He was right. Fall prevention deserves as much attention as bone strengthening. Some key strategies include removing trip hazards like loose rugs and clutter, improving lighting, especially in stairways and bathrooms, installing grab bars and railings, wearing supportive, non-slip footwear, addressing vision problems, promptly reviewing medications that might cause dizziness, strengthening exercises that improve balance and coordination. I now recommend a home safety evaluation for all my patients with osteopenia or osteoporosis. Sometimes the simplest changes, moving a coffee table, adding a lamp, installing a grab bar, can prevent a life-altering fracture. As we wrap up our main discussion, I want to look forward to what's on the horizon for bone health, because there are some exciting developments. Bone density testing itself is evolving. Newer technologies can now assess not just bone density but bone quality, the microarchitecture of your bones that contributes to their strength. This gives us a more complete picture of fracture risk. There are also emerging medications that work in novel ways. Some new therapies can actually build new bone rather than just preventing loss, something we couldn't do effectively until recently. Genetic testing is opening doors to personalized approaches. We're beginning to identify genetic markers that indicate who might be at higher risk for bone loss or who might respond better to certain treatments. And technology is helping with prevention too. There are now wearable devices that can detect changes in gait that might predict fall risk, and apps that can guide you through bone-strengthening exercises with proper form. I'm particularly excited about integrated approaches that combine medical treatment with lifestyle coaching. In my practice, we've started bone health groups where patients learn from nutritionists, exercise physiologists, and each other. The results have been remarkable, not just in improved bone measurements, but in overall quality of life. As one of my patients, 75-year-old Sophia, said after 6 months in our program, "I came here worried about my bones, but I'm leaving with a whole new outlook on aging. I'm stronger in every way." So here we are, at the end of our conversation about your bones, these remarkable structures that have carried you through every step of your life journey. They deserve your attention and your care. I hope I've convinced you that a bone density test isn't just another medical procedure to check off a list. It's a window into a critical aspect of your health that affects everything from your posture to your independence. If you're over 65 as a woman, over 70 as a man, or have any of the risk factors we discussed, please talk to your doctor about getting tested. If you've already been tested, make sure you understand your results and have a plan tailored to your specific needs. Remember, your bones are alive. They respond to how you treat them. They can become stronger with the right nutrition, the right movement, and when necessary, the right medical support. I think about my mother often, how a simple fall changed so much for her. But I also think about patients like Robert, Elena, Margaret, and so many others who took action when they learned about their bone health and changed their trajectories. You can do the same. Your bones have supported you your entire life. Now it's time to return the favor. This is Dr. Sarah Mitchell, wishing you strong bones and a vibrant life for all the years ahead. Thank you for listening, and remember, When it comes to your bone health, knowledge truly is power, and it's never too late to build strength.